Hello, everyone. I am Salim Virani, and I serve as Vice Provost for Research and Professor of Medicine at the Aga Khan University in Pakistan. So, we are so excited today to be talking about the 2023 American Heart Association and American College of Cardiology guideline for the management of patients with chronic coronary artery disease. So, we need to make sure that patients are front and center when it comes to decision making as well as implementation of these therapies, right? We know from randomized controlled trials as well as systematic reviews with meta analyses that a patient centered as well as multidisciplinary team based approach can improve patient self efficacy, health related quality of life, as well as risk factor management. The second is patient education is extremely important because we know, as you will see when we discuss more aspects of this guideline, that social determinants of health are extremely important. We have a lot of lifestyle changes that we recommend. We have a lot of things related to symptom management. Therefore, patient education, and that education does not happen during one visit. It is just an ongoing phenomena that happens on every visit. And it is extremely important to do that education at every visit to ensure that our patients are making informed decisions, both in terms of what is important to them, so we can focus on them, and then it improves their self efficacy to be able to follow what is being recommended. Because we know that adherence to both lifestyle therapies as well as medical therapies is extremely low when it comes to patients with any chronic condition, including patients with chronic coronary disease. And then the other aspect of this is that when we educate our patients, when we put them front and center of every decision making, that is what will lead to shared decision making. Now, whether that is uh, in terms of what therapies to use, what treatment strategy to use, and the end goal of that shared decision making is not receipt of a therapy or a treatment strategy, but it's the quality of that decision that is made between the clinician and the patient. And this becomes extremely important when there is a significant risk with a therapy or there is a trade off that exists between the benefit and risk. And that's why it is extremely important to keep patients at front and center. The other aspect of this that I would like to emphasize when it comes to general management principles for patients with chronic coronary disease is to always keep in mind what is the out of pocket cost for our patients whenever we are initiating a new medication or even continuing a medication. So, as long as we are talking about out of pocket expenses, it will allow us to address one of the most important reasons why our patients may not be able to remain adherent to what we are recommending to them.